The H1N1 swine flu is a respiratory disease caused by influenza viruses that infect the respiratory tract of pigs. The virus can be transmitted to humans, resulting in a dry, harsh cough, decreased appetite, nasal secretions, fatigue, fever, sore throat, body aches, chills, vomiting, and dizziness. Swine flu can also lead to more serious problems, including pneumonia, lung infections, and other breathing problems. It can make an illness like diabetes or asthma worsen. If you have similar symptoms, please seek medical attention immediately. Swine flu is transmitted from person to person by inhalation or ingestion of droplets containing the virus from persons who are sneezing or coughing, and it is not transmitted by eating cooked pork products. To prevent the spread of infectious diseases like influenza, the public is urged to cover your mouth and nose with a tissue when coughing or sneezing. Wash hands with soap and water regularly, and avoid close contact with people who have flu-like symptoms. Remember to be on the lookout for symptoms such as decreased appetite, dry coughs, nasal secretions, fatigue, fever, sore throat, body aches, chills, vomiting, and dizziness. Please take all preventative measures. Safe and effective vaccines that can prevent influenza or reduce the severity of illness are available at local health centers. The Caribbean's tropical climate has been susceptible to mosquito-borne diseases such as the ZIKA virus. It is spread by the bite of an infected Aedes aegypti mosquito, which can also transmit dengue and chikungunya. People are urged to keep their surroundings clean and empty all unnecessary water collection vessels, including flower pots, old tires, and old paint pans, in a bid to prevent the Aedes aegypti mosquito from breeding. People with Zika virus infection may have no symptoms or may suffer mild to moderate symptoms including fever, headache, rash, as well as muscle and joint pain. The virus is not deemed fatal but can lead to complications. The Ministry of Health continues to monitor all diseases of public health importance.
It might seem like this little guy here would not cause much trouble, but don't take his size for granted. He is the Aedes aegypti mosquito and is responsible for transmitting a number of deadly vector-borne diseases. You know them as dengue, chikungunya, and the Zika virus. In the Caribbean, the Aedes aegypti mosquito population is rampant, having been the cause of numerous deaths.
We have two species of Aedes mosquito in the Caribbean, including Trinidad and Tobago. We have Aedes aegypti, which you mentioned, and another one called the Asian tiger, Aedes albopictus mosquito. And these mosquitoes are the vectors for three important viruses that people can get. Chikungunya, most people would remember we had a big outbreak last year of Chick V, as it was called. We have dengue most of the time, so eradicating the mosquito or controlling the mosquito population will help prevent dengue transmission. And there's a new virus that we don't have yet in Trinidad, but that's spreading rapidly in the Americas, and we do expect will hit the Caribbean fairly soon, called Zika virus. So as the same mosquito transmits all three viruses, it is a very good strategy to try to reduce the population, yes.
But what makes the Aedes aegypti mosquito recognizable? Its white markings on its legs and a marking in the form of a lyre on the upper surface of the thorax makes itself distinguishable from the other types of mosquitoes. While it is known to be attracted to carbon dioxide emitted, they most commonly bite at dusk and dawn, indoors, in shady areas, or when the weather is cloudy. They can bite and spread infection all year long and at any time of the day. The Ministry of Health in Trinidad and Tobago has a plan to eradicate the Aedes aegypti mosquito. What exactly is that plan? And how can we as citizens assist?
Well, the ministry's plan to control the Aedes aegypti. So let's talk about the vector. The vector, as you know, is a little mosquito pest called the Aedes aegypti. So the plan is focused around controlling the vector. And that plan has to be a totally integrated, coordinated, cooperative plan encompassing a range of ministries and a range of agencies. So for example, the Ministry of Health will be spearheading, but we can't do this without the cooperation of Port Health. So for instance, car parts and tires that are coming in, we have to have a certificate of clearance from the ship captain to state that these items have been sanitized. So that's part of the management process. We have to include the Ministry of Local Government because they have a responsibility to help us with waterways, with vacant lots, and so on. We need to work with the different corporations. We need to work with insect vector. We need to work with all the agencies that impact on the environment, CPEP, etc. But at the end of the day, the plan can only work if there's a partnership between the state and the individual householder. The state can do what it can, but at the end of the day, this mosquito, Aedes aegypti, is closely associated with human habitation. In other words, wherever you find people, you find the mosquito. It's inside your homes, in your vases. It's in your plant pots, in the sources that collect water. It's in your barrels that collect water. It's in your gutterings. So all these sources of clear, stagnant water are breeding sites for the mosquitoes. So we will do our part by educating. We will do our part by spraying and fogging. We will do our part at the points of entry. But it's a partnership at the end of the day with the individual, with the community, and the state.
One female mosquito can lay up to 100 eggs on the inner wet walls of containers, ponds, or drains, with its larvae hatching 2 or 3 days after eggs have been laid. In the following days, the larvae will feed on microorganisms and particular organic matter, shedding their skins 3 times in order to grow. When the larva has acquired enough energy and size and is in the 4th larval stage, metamorphosis is triggered, changing the larva into a pupae. Pupae do not feed. They just change in form until the body of the adult flying mosquito is formed. Then the newly formed adult emerges from the water after breaking the pupal skin. It takes 7 to 10 days for the eggs to go through the 4 larval stages of life, first becoming a pupae, then transforming to the adult, where it can take its first blood meal. However, their survival depends on a thriving habitat. Dr. Vocati describes these areas as being any stagnant, non-flowing water collected for this period.
The thing with these mosquitoes is that they're mostly in urban areas and frequently in and around the household. So there is a lot that communities and individuals can do to reduce the mosquito population in their immediate environment. So as we all know, it's the rainy season starting now, and this is the peak time for mosquito populations because they breed in stagnant water. And so very often they will breed in artificial containers in and around the home, and there's a lot that people can do to try to minimize or get rid of these sorts of containers if possible. Things like dog water bowls, plant pots around the home, tires, anything that collects water should either, if you can get rid of the container if you don't need it, turn it over so it doesn't accumulate water. Plant pots should be emptied frequently so there's, even a little bit of water in, the drainage, the drains that people put around the plant pots. Clogged drains, clogged guttering around the house, water can accumulate and sit there, and this can become a breeding ground for Aedes aegypti mosquito.
Did you know the lifespan of an adult mosquito is approximately 3 weeks? Here are some life-saving prevention tips. Avoid outdoor activities when they're most active, dusk to dawn. Use mosquito netting. Use insect repellent. Wear light-colored long sleeves with socks and closed-toe shoes. Wash out flower vases thoroughly at least once a week. Unclog roof gutters. Empty water receptacles, dog bowls, barrels, containers at least once a week, and preferably more often, and scrub them out. Get rid of old tires in your yard. Empty outdoor flower pots regularly or store them upside down so that they cannot collect water.
There are no vaccines for your typical mosquito-borne viruses, unfortunately. So there is no vaccine for either dengue, CHIKV, or ZIKA. That is why we are emphasizing this partnership between the community, the individual, and the government. The best vaccination is personal responsibility at the level of the homeowner, working in tandem with the state, providing resources in terms of fogging, mosquito nets, zappers, education, but it's a partnership.
I think we all have a responsibility for our environment, and we can't depend on the government to take care of all the mosquitoes in Trinidad and Tobago. Insects are very hardy, they're very smart, and they're very difficult to combat. And so we need to be careful to look around our environment, eliminate any standing water, any receptacle or container that can accumulate water, keep our drains clean, keep our gutters clean to try to prevent mosquitoes coming in, and use screens if you can, bed nets if you can, especially if you sleep in the daytime, and try to use insect repellent and prevent your children, your family, and yourselves being bitten by mosquitoes.
The fight against the Aedes aegypti mosquito is real, and as Minister of Health Terence Dialsing explains, the fight is in your hands too, as mosquitoes can be found anywhere.
Where the battle will be won and fought is at the level of the community, in the homes, in your kitchens, on your dining room tables where you keep your flowers. That is where the battle will be won and fought. Outside in your yards where you have your barrels with water, where your gutterings are, and your gutterings are collecting water. These are the things that have to be cleaned and examined. And let me make a point. It is not just throwing the water out of the vase. It is taking a sponge with soap and scrubbing the insides of the walls of the vase, because that's where the eggs are laid. And when you pour out the water, the eggs are still there. And those eggs can stay in a dormant state, in a dry dormant state for up to a year. So when you refill the container with water, the eggs hatch. And one female lays about 100 eggs. So if you have 10 mosquitoes in your house, you have 1,000 eggs. And that is where the personal responsibility of the homeowner is so crucial in this fight.